That is not to say, though, that tasks that doctors do can't be performed by technology. Whoops. We've actually looked across where we think the opportunity for artificial intelligence is going to play itself out economically by category of, a series of categories here. And we published this. By 2026, we think that the greatest amount of economic opportunity is going to be in a series of things. If you look at the top of the list, robotic-assisted surgery, virtual assistant, and administrative workflow. Now, I want to just make a point about robotic-assisted surgery. That economic capacity is primarily coming through reduced length of stay and resource consumption. It's coming through economic capacity, not through clinical outcomes. Because what's happening is the surgery is getting so good that we're both moving the site of surgery as well as we're changing the outcomes in terms of the complication rates and therefore the length of stay, creating physical capacity to do more work without making the factories bigger. And then after that, when you look at things like virtual nursing, you see this in two different places. One of them is a physical robot. There are shortages of nurses in Japan right now, in a country that has essentially no birth rate and no immigration. And the work being done by nurses that you see today, if you went to a hospital in the US, are being done by anthropomorphic agents that are moving around and collecting basic information. Now, there's still nurses making judgments, but the data collection and the observation is being done by a physical robot. Similarly, you're beginning to see companies build technologies that can provide the kind of coaching and disease management that's today often done by a live conversation with a nurse or a coach, essentially with a technology or an avatar, getting both, in some cases, both the benefit of less expensive resources to solve the same problem, and in some cases, better efficacy, because we know for an absolute fact that there is actually a stigma associated with sharing your information with another person, and then administrative workflow. We're seeing this play itself out in the reading of documents for many purposes, insurance administration and payment. In fact, the two largest sources of labor in the healthcare provision system, outside of the clinical labor, are labor associated with payment and labor associated with essentially customer service, making an appointment, finding out information. Both of which are amenable to technologies available today to begin to take over some of those tasks.